we're told he's tested often. But was he tested on Tuesday before he went to the debate? And then was he tested on Thursday morning before he went to New Jersey?
Yeah, I'm not going to give you a detailed readout with timestamps of every time the president's tested. He's tested regularly, and the first positive test he received was after his return from Bedminster.
Was he tested between Wednesday night and the time he went to New Jersey?
Again, not giving a detailed readout of his testing, but safe to say his first positive test was upon return, or at least after Bedminster that trip. Thank you guys very much.
And that is how forthcoming the White House has been with information regarding the president's COVID-19 testing. We have no idea when he actually tested positive. Good morning and welcome to Morning Joe. It is Monday, October 5th. With us, we have White House reporter for the Associated Press, Jonathan Lemire, NBC News Capitol Hill correspondent and host of Way Too Early, Casey Hunt, former White House advisor for health policy and vice provost for global initiatives at the University of Pennsylvania, Dr. Ezekiel Emanuel is with us. He's an NBC News and MSNBC senior medical contributor. And Dr. Vin Gupta. He's a pulmonologist and an NBC News medical contributor. Good to have you all on board. The White House continues to provide limited and oftentimes contradictory information about President Trump's health. We learned yesterday that the president has been given dexamethasone, a steroid used to treat severely ill COVID-19 patients. Some health experts argue that's a red flag right there, because while the drug can reduce the risk of death for critically ill patients, it can cause harm to those with less severe symptoms. Dexamethasone is the third drug the president has taken since being hospitalized on Friday. He's also taken the antiviral drug remdesivir and an experimental antibody cocktail by Regeneron. White House physician Sean Conley said yesterday that the president has experienced 2 episodes where his oxygen saturation levels dipped. One of those instances was on Friday when the president was running a fever and was given supplemental oxygen. Speaking to reporters on Saturday, Dr. Conley repeatedly evaded questions about the president receiving oxygen. Yesterday, he tried to clear the matter up.
Has he ever been on supplemental oxygen?
Right now, he is not on oxygen.
I know you keep saying right now, but should we read into the fact that he had been previously?
Yesterday and today, he was not on oxygen.
So he has not been on it during his COVID treatment?
He's not on oxygen right now.
Over the course of his illness, the president has experienced 2 episodes of transient drops in his oxygen saturation. Thursday night into Friday morning, when I left the bedside, the president was doing well, with only mild symptoms, and his oxygen was in the high 90s. Late Friday morning, when I returned to the bedside, the president had a high fever, and his oxygen saturation was transiently dipping below 94%. Yesterday, there was another episode where he dropped down about 93%.
Irregularities in his lungs. Are there any obesities? Are there anything?
To disclose that the president had been administered oxygen?
It's a good question.
Thank you.
I was trying to reflect the upbeat attitude that the team, the president, that his course of illness has had. I didn't want to give any information that might steer the course of illness in another direction, and in doing so, it came off that we were trying to hide something, which wasn't necessarily true. So here I have it. He is the fact of the matter is that he's doing really well.
Dr. Conley went on to say that the president could be discharged from the hospital as early as today if his condition permits.
So, Jonathan Lemire, you have been on ground zero of this story from the beginning and have been out at Walter Reed. We've been talking a good bit this weekend, trying to sort through, as all you reporters have been doing, trying to sort through exactly what's been going on. What we know Monday morning is this. The White House lied repeatedly about the president's condition on Friday. The White House doctors lied repeatedly about the president's condition on Saturday. The White House doctors admitted on Sunday, in fact, that they had lied about the president's condition on Saturday. And I think there was the suggestion that they did so not to upset their patient, which is their primary concern. But then even yesterday on Sunday, the number of incomplete answers, hedges regarding how low his oxygen level went, how often it was it in the 80s? How about the lung scans? What are these tests revealing? Do we have any assurance at all that anything these doctors are telling us about the president's condition is truthful?
Let's say this right up front, Joe. This is a national security threat, and the White House has a credibility crisis. There has been mixed messaging and non-answers and outright lies since Friday, when the president was taken on Marine One from the White House to Walter Reed Medical Center. I was there, as you said, on Saturday when we pressed the doctors about whether or not the president had ever received supplemental oxygen. He dodged, he evaded, he was very cagey, Dr. Connolly, sort of very almost cute in his answer, suggesting, well, he's not on it right now, or no, he wasn't on it yesterday, or he hasn't been on oxygen since this team was assembled. And then further reporting hours later revealed that indeed he had received supplemental oxygen at the White House on Friday before he was transported, because his oxygen saturation level had dipped. We know that happened again on Saturday. His level also dipped. We also know that he has, as Mika said, is on this now powerful steroid, which is usually reserved for critical COVID cases and also used in tandem with oxygen. But yet we're still not getting straight answers in terms of exactly when the president may have received another dose of oxygen. Compounding the confusion, after that briefing on Saturday given by the doctors, within an hour, Chief of Staff Mark Meadows provided an entirely different accounting of the condition of the president, painting a much more sort of sober assessment, revealing that the president had been in a tougher spot Friday morning. Yesterday, we also saw again, though some more information was presented, other questions were dodged. The doctor did not get into whether the president had had a lung scan. The doctor did not suggest some evaded questions about what other treatments he may be receiving. He offered a very rosy timetable, suggesting that President Trump could go home as early as today, which flies in the face of what we had been told earlier over the weekend, that he was on a 5-day treatment of remdesivir and that it was highly unlikely that he would leave before then. So right now, and the morning after, the president got into a motorcade and did a brief tour of supporters outside Walter Reed Medical Center when he stepped into an SUV with Secret Service agents who had to be clothed head to toe in protective gear, wearing face shields and masks, so the president could see his supporters. The president putting them in danger, being in an enclosed space, a COVID-19 patient with these agents, who of course are sworn to protect him. America wakes up Monday morning still not really knowing how the President of the United States is doing, and right now not believing that they can trust everything that the White House and the doctors are saying.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.